Thank you very much. Right now I find myself in quite a challenging position because it's quite difficult for me to add new insights of what worked, what didn't work when it comes to the MDGs. And certainly I don't have the experience worth sharing compared to my fellow panelists and the chair. But I guess there's a reason why my colleagues have invited me to join the panel, and I hope this has little to do with gender balance. What I really would like to bring to the table are a few insights coming from the Development Progress Project, which is hosted at ODI. We're currently working, myself and my colleague Gideon Rabinovitz, on a paper which Richard will be reviewing next week. Hopefully will be available next January. But I really wanted to kind of share some concrete examples of how progress has been financed. May I have the mouse? Yep, thank you. So, Development Progress is a 4-year project, as I said, hosted here at ODI. It kind of included more than 50 researchers in the institute that aims to better understand, measure, and communicate progress in developing countries. I wanted to kind of say something on what has worked in development and why. The main objective of the project is really to kind of portray less known stories of progress across 8 dimensions of well-being. Essentially, they resonate with the findings of the St. Stiglitz Commission. Some of them, as you can see, do overlap with the MDGs, in particular primary education. Others are kind of linked to what will come with the SDGs. I'm talking about understanding, for instance, improvements in post-primary education. So I can see there are more than 50 case studies, so there is no shortage of evidence to understand, for instance, lessons on how the MDGs were financed and also some kind of insights on how the SDGs could be financed. So, in a sense, this case study approach can really merge and fill a gap between 2 very different literatures. I mean, we have, on the one hand, the micro-level analysis with randomized controlled trials, but actually they look at the micro level. It's quite difficult to kind of draw lessons at broad-based progress. And on the other hand, we have cross-country quantitative analysis, and where the evidence against financing is quite mixed, and also it's quite difficult to draw some kind of policy recommendations. I wouldn't be a good economist if we didn't put any caveats to this analysis, which is kind of inherited to the type of case studies colleagues here at ODI and work on. I make 3 points before moving into the more kind of meaty part of the presentation. First of all, we evaluated actually the association between financing resources and progress. We didn't assess any kind of causality link. This is very much kind of associated with the type of project. These are qualitative type of analysis, and we share with several different kind of research projects. We lack a counterfactual. The second point is the fact that we probably have a bias in the case studies. So these are all kind of stories of progress. So we don't know what happened, for instance, about financing when progress didn't materialize. So this is quite an important warning. And final and last point, we kind of look into more than 50 case studies across these 8 dimensions. So we have 5-6 case studies per dimension, and the kind of theoretical framework, the financing modalities and mechanisms do differ across sectors. So just 3 warnings before I move on to the kind of messages emerging from the analysis of these case studies. I'll focus on 3 of them, and I will illustrate them with some of the examples which already Gary has mentioned around them. And unfortunately, I will be superficial. Time is pressing and short, but I'm really happy to kind of elaborate a bit more on some of these examples later on. First of all, at the macroeconomic level, in nearly all the case studies that we looked at, actually progress took place when there was a sustained growth performance, in turn with the expansion of government revenues and also growing allocation to the sector. Here I picked up 5 examples, and I'll just illustrate 3 of them. I mean, Ethiopia has nearly achieved the universal primary education, and actually, if we compare in the 80s, I mean, the government allocated 10% of its budget to education, and more recently, we're talking about 1/4 of public expenditure to education. Same example applies to the case of improvements, again, in primary education in Benin, where the education budget doubled between the mid-90s and the mid-2000s. And also in Kenya, I mean, the country experienced quite good growth performance over the last decade, more or less 6%. There's been greater domestic resource mobilization, and the country has actually met the 20% target of education expenditure over its budget. So growing resources allocated to the sector. My second point is that, I mean, Kapil has kind of talked earlier on about the different financiers of development, but in all the case studies we looked at, actually there were only three main actors: government, households, and development partners. I mean, there were a few figures around philanthropic organizations, emerging donors, but actually they never featured in the case studies we looked at. I mean, probably they do kind of support small-scale interventions, and also most of the episodes that we looked at took place between the early 2000s and mid-2000s, so when the kind of volume of their assistance was probably too low. But there's quite an interesting kind of point, and it kind of goes back to the kind of role of the different financiers that we were talking in the earlier session. Actually, in nearly all the case studies we looked at, actually progress was associated with shifting burden from households to governments or to development partners. I mean, a lot has to do with the abolition of users' fees, just to give an example. Again, I picked up a kind of a few examples in here. I mean, in the case of improvements on maternal health mortality in Nepal, there was progress was associated with falling out-of-pocket expenditure. In a sense, it was more or less 70% in the 90s, 50% over the last decade. In the case of Mozambique, there's been a growing contribution of development partners vis-à-vis governments and households. And we have a few examples of the impact of the abolition of school fees, for instance, in enrollment rates, when it comes to Kenya on post-primary education, secondary in particular, and in the case of Cambodia in primary education. Let me go to my third point, and this is also the final one. In most of the low and lower middle income countries investigated for this particular project, progress was always associated with growing financial support from development partners, either in the form of kind of covering recurrent costs or financing infrastructure development, even though with different degrees of intervention. I think this kind of supports some of the points Kevin has made earlier on in terms of the role of development assistance. In the case of Mongolia, on improvements in access to secondary education, it's quite an interesting case study. Actually, donors and the Asian Development Bank in particular partially compensated the fall in assistance from the Soviet Union during the transition, and they've been quite decisive in the reforms in the education sector. In the case of Cambodia, and improvements in primary education, we're talking about a five-fold increase in external assistance, in particular associated with the sector-wide approach. And the role of donors was quite decisive in the transition from post-conflict to kind of independence. In the case of Liberia and Timor-Leste, quite decisive role in the security sector. I want to make the very final point in terms of the role of technical assistance in richer countries. I mean, we saw actually that even though financial assistance was quite small, the contribution of development partners, in particular multilateral development banks, has been quite decisive in achieving progress. And I kind of cite three different examples. The first one has to do with improvements in water management in China. And actually, my colleagues, authors of the report, really stressed the critical role in piloting new approaches or intervening in areas that have been neglected by the government. In the case of Vietnam, rural energy has been quite kind of decisive, again, role in the design of rural electrification programs and in capacity building. And finally, when it comes to improvements in education quality in Indonesia, my colleagues have really found a clear role by particularly the World Bank in terms of improving financing modalities to make access to education more equitable and to introduce performance-based incentives across schools. Let me now conclude. I mean, I said there are a few kind of caveats from the development progress case studies, but I think there's a lot of kind of experience and evidence worth sharing in terms of the impact of financing the MDGs and the Sustainable Development Goals, especially when it comes to the role of shifting burden from households to government and development partners, and the role of development assistance more broadly. As I said, these are stories of progress, not stories of success. So, of course, there are some challenges that are being highlighted in all the case study reports to make progress inclusive and financially sustainable. I'll stop here. Thank you.
But that was fantastic. I mean, some really interesting data-based evidence of this. This is a complicated picture, but don't throw ODA out with the bathwater, because it's got a critical role. Let me just offer an observation on what we've heard to link it to both what went before and the discussion that now follows. And I think it is worth saying, that there was a presumption at the turn of the century that there was a massive human capital deficit across the developing world, that millions of kids were just not getting access to education, were dying from malnutrition. I mean, there was just this overwhelming view that the most important crisis, if you were to triage the many challenges of development, was to just try and open up the opportunity of the beginnings of a decent life for the poor of the world. And, so in that sense, it was a self-admittedly welfareist thing in a way. It was to use ODA to try and provide that critical human social safety net. But of course that was never going to be sufficient, because you had to find a way of allowing countries to develop the revenue base of their own to sustain this long term, and you had to find the way to create the jobs and the economic dynamism to allow those kids whose lives you'd given a first start to become productive citizens and have their own families and provide for those families. So the fact that the conversation moves on to how in this second round we can engage the market and the private sector is a perfectly healthy and correct evolution from the original concept. But I think the key point you've heard from this panel and from certainly Kevin and myself is, in doing that, we mustn't take our eye off the ball of the role of ODA, but more importantly than ODA, the role of basic provision by the state of health and education and potentially other basics, even the bits of infrastructure which are hard to fund, to pick up what was said in the last session. So some way or another, we look at a mixed model going forward, I think. So with that, let's open the floor to questions and comments.